Okay, second video in this series. Video number 23, this would be. What do we tell other professionals about what we're doing, about what we think we're doing with this sort of myofascial release, manual therapy type of approach, but from that patient-centered perspective versus that fascial perspective? This is probably the one that most therapists, most clinicians have difficulty with, because the way I present it is relatively vague, and it's vague based on the honesty of not knowing if we truly have the ability to target fascia under the skin, to target a trigger point under the skin, to target muscle tension, as if muscle tension in isolation can be blamed as the cause without an influence from the nervous system that feeds that tension, and the sensory system which feeds back to the brain, etc. But yet those are the stories that other clinicians, referral sources, doctors, etc., that they tend to tell too, and they tend to tell to their patients, and they talk about with other clinicians. So what do we tell them? Well, first off, you can't say, gee, I don't know what it is, because that doesn't make you sound very intelligent or trustworthy. What I typically do when confronted with a problem like this is, and I have to do this a lot, both with my referral sources as well as when I teach this work, is to say, well, some people could say it's the way I was taught, that it's fascial restriction. But fascial restrictions have never really been proven to exist. They're more of a metaphor for tightness, if you will, for a sense of holding in the body that we've said is fascia, is fascial tightness, is fascial scarring, is fascial restriction, and that when we do things with our hands and with our interaction, we can quote unquote release that fascial restriction. But another clinician might say, oh no, that's not fascial restriction, that's muscle tension, or that's a trigger point, or the countless other stories that people tell. And I bring this up to other professionals to let them see all the various ways people explain it. And they're really just these parallel views and parallel universes that everybody's talking about the same thing, but using different languages to explain it. And I think sometimes, most times, when we confront the situation of needing to explain our work, if you explain to them the problems, the way, like I just said, that nobody really knows. Everybody thinks it's this one thing versus the other thing versus a third thing. But in reality, it could all be more of a simple issue of the nervous system not having let go of an injury event or something like that, or trauma, or yes, surgery, etc. That possibly just a calming influence on the nervous system, doing some cutaneous or peripheral nerve glides, possibly working deeper, if we can truly impact structure, tissue per se, and release that fascial restriction if they exist, to release that trigger point if they exist, to somehow grab hold of that muscle tension and do something with it to make it less. That's really what's happening. But are all those stories true? I think there's probably a simpler explanation that sort of encompasses everything. The thing that I strongly stress is our target shouldn't be a tissue, or the pathology that's deemed related to that tissue. The target of my intervention, the evaluation and treatment, the target of my intervention should be the person's complaints, that what brought them into my office. So instead of saying, okay, right now I'm going to target your muscle tension, I might say to them, well, right now I'm going to target that difficulty you have swallowing, or that pain you get when you chew, or the difficulty opening your mouth, whatever that might be, head to toe. Instead of talking about the tissue and the pathology, let's turn it around, make it more patient-centric, and say, let's target your complaints and see if we can do something about that. And the more you practice that sort of a verbal interaction with your colleagues and other professionals, etc., I think it just gets easier and easier if they're willing to be honest and say, yeah, I can see why you feel that you can't really know what's under the skin causing this.